Hello everyone, I'm Dr. Raghava Priya, tutor, Department of Public Health Dentistry. Today we are going to discuss about dental indices. Dental indices. What are dental indices? They are the standardized tools used to measure and quantify various aspects of oral health. They provide a systematic way to assess dental conditions, facilitating comparison across different populations and studies. Index is nothing but numbers which is used to find out incidence, prevalence and severity of the disease, based on which preventive programs can be adopted. In simple terms, it is an expression of clinical observation in a numerical value. Let us see the definition of index. An index is defined as a numerical value describing the relative status of the population on a graduated scale with definite upper and lower limits, which is designed to permit and facilitate comparison with other population classified with the same criteria and method. This is the most common definition of an index given by Russell A.L. It states that it is nothing but a number describing the status of a population, like status of oral health, caries status, plaque status, gingival status in a graduated scale. It is like a scale with graduations in between with definite upper and lower limits. For example, in OHIS index, upper limit is 6 and lower limit is 0. Why we are using this is to facilitate comparison with other population classified with the same criteria and the method. So comparison with different groups is what the indices are made. That is the definition we need to by heart. So let us see what are the ideal requisites of indices. They are the clarity, simplicity, objectivity, validity, reliability, quantifiability, sensitivity and acceptability. Let's see one by one. What is clarity and simplicity? The index should be easy to understand and used by practitioners. It should have clear criteria and scoring system. This explains the clarity and simplicity requisite of indices. Let's see what is reliability. The index should provide consistent results when used by different examiners or by the same examiner at different times. This is the reliability of index. The next requisite is validity. What it states that the index should accurately measure what it is intended to measure. It should totally reflect the presence, absence or severity of the condition being assessed. The next requisite is quantifiability. It states that the index should provide data that can be easily quantified, allowing for statistical analysis. Moving to the next requisite, sensitivity. Index should be capable of detecting small changes or differences in the condition being measured. High sensitivity allows for the early detection of diseases and monitoring small improvements or deteriorations. The other requisite is specificity. The index should accurately identify those without the condition. High specificity ensures that individuals who do not have the disease are not incorrectly diagnosed. The next requisite is acceptability. The index should be non-invasive and acceptable to patients and practitioners. It should not cause any discomfort to both of them. This explains the ideal requisites of indices. Let's move on to the uses of indices. It is used for individual patient, in research and in community. For individual patient, it is used to identify the oral problem, that is in the recognition of oral problem of individual patient. And the next one is the effectiveness. It is used to assess the success of correct oral hygiene practices of individuals and to motivate the individuals in preventive and professional care, that is to encourage the preventive and professional care to control and eliminate diseases. Uses of dental indices in research. To Determine the baseline data. It is to use to establish the initial data before introducing to the experimental factors, and to measure the effectiveness, that is evaluate the impact of specific agents for prevention, control or treatment of oral conditions. Uses of dental indices in community. It is used to show the occurrence of conditions, that is prevalence and incidence. It is used in the needs assessment to determine the community's oral health needs, and in the program evaluation to compare the effects of community programs and evaluate the results. We have seen the uses. Now we are moving on to classification of indices. They are classified based on the fluctuation of scores. Based on the fluctuation of score, they are classified as reversible index and irreversible index. Irreversible index, it measures the condition that cannot return to the original state once they have occurred. Example, DMFT index, that is it measures the decayed, missing and filled teeth which cannot return to its original state. So it falls under the irreversible index. Reversible index, it measures the conditions that can return to the original state. So it can return to its original state. The example is gingival index, which measures gingivitis, which is a reversible condition. So it falls under the classification of reversible index. The next classification, depending upon the extent to which the areas of oral cavity are measured. It is classified as full mouth indices and simplified indices. Full mouth indices, it evaluates the entire mouth. Example for full mouth indices is full mouth plaque score. So it examines each and every tooth in the oral cavity and the scores are given. Simplified index, it is to evaluate the specific parts or subsets of the mouth. Example of simplified index is simplified oral hygiene index. It evaluates particular tooth and scores are given accordingly. The next classification is based on the entity which they measure. According to the entity, they are classified as disease index, symptom index and treatment index. Disease index, it measures the presence or severity of a disease. Example of disease index is DMFT index. So it measures the decayed, missing and filling tooth so as to assess the severity of caries in a oral cavity. Symptom index measures the symptoms associated with the condition. Example of symptom index is pain index in endodontic cases. It assesses the pain among the patient. Treatment index, it evaluates the need or outcome of treatment. Example of treatment index is orthodontic treatment need index. The next classification is general indices classification. It is classified as simple index and cumulative index. Simple index, it measures the presence or absence of a condition. Example, plaque index, which measures the thickness of a plaque at the gingival margin. Cumulative index, it is a measure the total past and present evidence of a condition. Example of cumulative index is DMFT index, which includes decay, missed and filled tooth, so that it measures both the past and present evidence of caries condition. Next, let us see the criteria for selecting an index. It is similar to that of the ideal requisites of indices. So, it must be simple to use and calculate. It should permit the examination of many people in a short period of time, and it require minimum armamentarium and expenditure. It should be highly reproducible in assessing the clinical condition when used by one or more examiners. not cause discomfort to the patient and should be acceptable to the patient, amenable to statistical analysis, and it should strongly related numerically to the clinical stages of specific disease under investigation. With this knowledge of dental indices, we end up with the session today. Thank you.